Right, let's talk about personal history, or I would say lots of questions are like lifestyle history. It's always better to say lifestyle for few questions instead of saying personal history. For example, if you're talking about smoking, you're talking about alcohol, you're talking about diet, you're talking about physical exercise, physical activity. So, these questions are not of personal history. I would say lifestyle, because smoking, alcohol, it is considered in the lifestyle, right? Because when you say personal history, it's quite personal. I would say like sexual history, menstrual history, that is quite personal. But I think smoking, alcohol is their routine actually. So make sure use the word lifestyle. And always, it's always better to do signposting before you ask these lifestyle questions. Because when you ask for smoking, alcohol, patient might be thinking, I came here to the hospital because of my chest pain. I came here because of cough. I don't know why this doctor is asking about smoking, about alcohol. So you need to show them the relationship between smoking and cough, between smoking, alcohol and chest pain. Right, so that's very important. So patient will not feel uncomfortable when you ask these questions. So better to do signposting before you ask these lifestyle questions or personal question. Let me ask you about some of your lifestyle habits, as they might be related to your problem. Let me ask you about some of your lifestyle habits like smoking and alcohol that might give me better insight regarding your problem, and we may be able to come up to your diagnosis quickly. So tell me, do you smoke? So this way it's very easy way to put the question in front of the patient. So always try to do the signposting. It will make your life easy, right? And also try not to ask consent again and again. Instead of saying, can I ask you some questions about your smoking? No, simply start. Let me ask you some questions about your lifestyle. Let me ask. I'm not taking consent again and again, right? So smoking, let's see what you ask for smoking. You need to ask, do you smoke? That's pretty important question. Do you smoke or not? Sometimes patient will say no. You are dealing with a case of cough. Patient has got hemoptysis. I'm just giving you an example, hypothetical example. It's a cough and hemoptysis. And you asked, do you smoke? And patient said no. Are you happy? Because we are thinking the patient might have lung cancer. The history that patient has given us, patient has got cough, patient has got hemoptysis, patient has got weight loss, loss of appetite, anemia symptoms, lumps and bumps, everything which is suggestive of lung cancer. But now this patient is saying no to smoking, which is quite unlikely. So if patient says no, then ask, have you ever smoked? That's very important. Your patient might say, yes, I used to smoke, I just quit 1 month ago. But that's very important for us to know, like whether he was a smoker before or not. So patient says no, and if it's really important for you, make sure you ask, have you ever smoked? That's very, very, very important question, right? And when you say, do you smoke? Patient says, yes, doctor, I used to smoke 2 packets, now I'm smoking 1. So if patient has already quit, or if patient has cut down, make sure you appreciate the patient. Well done. You did a good job. Right? So you need to appreciate the patient. If they have done something good, make sure you don't forget to appreciate them. That's really, really important. Right? So do you smoke? And if they say yes, and then you ask, what do you smoke? Because it's not only cigarette. There are other things also you can smoke. For example, it might be like lots of other things like you can smoke. So make sure you're asking, what do you smoke? Right? Maybe they are smoking shisha, they are smoking weed or other stuff as well. So what do you smoke? How much do you smoke? 1 packet, 2 packet? How often? Like daily? Because if a person is smoking cigarette, they usually smoke daily. But if a person is saying I'm smoking shisha, so they might not be doing it daily. So how often will be a good question. And since when you have been smoking? Do you smoke? What do you smoke? How much? How often? And since when you have been smoking? So these are the questions that you ask for smoking, which is very, very, very important, right? Then we have got question on alcohol. Do you drink alcohol or not? Right? So if patient has already quit or cut down, make sure you appreciate the patient. Do not forget, do not leave any point where you can appreciate the patient, right? Alcohol, we know like 14 units are okay. You can drink 14 units per week, 14 units per week, and you have to have 2 days alcohol free. So that's fine. NHS, they say like that's okay if you're drinking 14 units per week. It doesn't matter you're a male or a female. Initially it was different. For males it was 21 units. For female it was 14. But now they have made it same. It's 14 units per week for both males and female. And what they say like you should have 2 days alcohol free. It's not like binge drinking. It means like you're drinking all 14 units in one day and then 6 days alcohol free. No, that's not the thing. So it should be like roughly around 2-3 units per day if you're taking, and 2 alcohol free days, and taking 14 units in a week. That is acceptable. That's fine, right? So we ask the patient like, do you drink alcohol? If they say yes, what do you drink, how much, how often, and since when? The same like, what do you drink, how much, since when, and how often? But do you think patient is going to tell you I'm drinking 2 units, I'm drinking 4 units daily? No, they're going to tell you what kind of drinks they are drinking, right? So we should be able to interpret how many units they are drinking. For example, 1 can of beer, 1 beer can, it's almost 2 units. Again, it's a rough idea. It can be 1.5, 1.7, 2, 2.3, 2.4, 3 units in 1 can of beer, but roughly it is 2 units, right? 1 wine bottle, again it's a rough idea. 1 wine bottle roughly has 9 units, and 1 wine glass, it's a big glass, roughly around 3 units it has got. Sometimes they will be giving you the history like 1 shot of whiskey. So 1 shot of whiskey, which is 25 ml, has got 1 unit. Right, so 25 ml is 1 unit, and 1 bottle of whiskey, which is of 750 ml, will be having 30 units. It's a simple math, right? So 25 ml is 1 unit, so 750 ml will be 30 units. So they might be giving you the history, doctor, I'm drinking 1 bottle of wine daily. So you can calculate how many units. For example, patient is saying I'm drinking 1 glass of wine, I'm drinking 1 can of beer daily, I'm drinking a couple of 2-3 shots of whiskey daily. So now in this way you can interpret how many units they are consuming, right? So if you know about this beer, wine, and whiskey, that's okay. For example, they're telling you vodka, they're telling you rum, gin, try to put it as whiskey, almost the same level of alcohol they have got, because whiskey is roughly like 40% alcohol. It might be less or more, it might be 38%, 35%, maybe 45, 47% as well, but roughly 40% we are keeping, right? So this is a rough idea how you can calculate the amount of alcohol your patient is taking, right? So this is for smoking, for alcohol. And now physical activity. You need to ask, tell me about your physical activity. Are you physically active, right? You'll see like your patient will be giving you lots of excuses like how they are busy and why they cannot do their physical activity. But make sure you are asking about their physical activity, right? So what else you will be asking? You'll be asking about the diet. Diet is very important. Like, could you please tell me about your diet? So always ask like if your diet includes fruits and vegetables or not, because that's pretty important, because we need to know like what kind of, they are telling you that yes, my diet is good, but maybe they're eating burger and chips and they're saying my diet is good. So you should be knowing it in detail, like does your diet include fruits and vegetables? That's very important. Could you please tell me about your diet? Yes, I'm having good diet. So do you include fruits and vegetables in your diet? That's pretty important. And it depends on the question as well, what kind of questions you have got. For example, you have got a case of osteoporosis. You have got a case of osteoporosis, and like dairy products are very essential for osteoporosis. So to ask the patient like, do you include dairy products in your diet or not? Because that's pretty important for a case of osteoporosis. Right? Stress is important. Have you got any stress in your life? Right? Sometimes the response from the patient will be very much dramatic. Like they'll say, doctor, everyone has got stress. Don't you have any stress in your life? Yeah, it's kind of like funny answer you might get. But make sure you ask like, we are asking about any recent something has happened, maybe any work related or any family related stress. That is what we want to know. Right? Then patient will be able to give you the finding. Right? Stress is again very important. For example, patient has come to you with chest pain, because we know like stress is one of the very important risk factor, right? Then we have got recreational drugs. That's also very important. Do you use any recreational drug? That's very important. If they say yes, which drug? And the same way as you have elaborated alcohol, you do the same way. Which drug? How much do you take it? How often? and since when you have been taking it. But there is one question that you need to add, that is, how do you take it? How do you take it? That's very important, because alcohol you take orally, but recreational drug, if you're sniffing it, you are injecting it, that's very, very important for us to know. Right, so how do you take it? And if they say like, I'm using needles, you need to ask, are you sharing needles? Are you sharing needles? That's very, very important, because if they're sharing needle, they are more prone to have blood-borne infections as well, needle-borne infections. But sometimes you will get the answer from them that, doctor, I'm on needle exchange program. So you might be thinking, what is this needle exchange program? What is this needle exchange program? Like, you can actually exchange the needle. For example, you have used one needle, you can go to the pharmacy and give them the old one, the used one, and get the new one needle. So do you think it's a good practice by the government? Yes, it's good practice. I know, like, many people, they say like, do you think like the government, they are encouraging people to take recreational drug by giving them new needle? No, it's not the case. Actually, they are running lots of program to counsel the patient for recreational drugs. But however, if they are taking, you can't force them, but at least we can do something so that we can prevent the needle-borne infections at least. Right, so now you are aware what is this needle exchange program. So they might be using this word in the conversation, needle exchange program, right? Sexual history also we have got, so you need to ask sexual history, and here you can use personal word. That would be very important, like let me ask you some question about your personal history, your sexual history. It's very important for me to come up to the diagnosis, and these are the questions we ask to everyone, those who come to us with these symptoms. Yeah, so they won't be hesitating in answering your question, and also you should not hesitate while you ask these questions. Right? Are you sexually active? That's very important. Are you in stable relationship? So you need to ask, are you sexually active? Are you in stable relationship or not? And do you have any other partner? And if they say yes, I have another partner, how many partners do you have? And when we take sexual history, usually we are concerned about last 6 months, because the sexual transmitted infections like gonorrhea, like chlamydia, they can stay in the body for 6 months without causing any symptoms. But when our body immunity is low, they might flare up and give you some symptoms. So we are asking the questions about last 6 months history, sexual history, right? And always try to use the word STI, never say STD. It's sexual transmitted infection. It's not sexual transmitted disease. So STI always. Are you sexually active? Are you in stable relationship? And ask, do you have any other partner? How many partners? If they say yes, right? Ask about, like, do you practice safe sex? Right? Do you practice safe sex? About this partner and about the previous partners as well, everything, right? So do you use condoms? Or you can ask, do you practice safe sex? And when was the last time you had unprotected sex? Right? So do you practice safe sex? Yes, doctor. When was the last time you had unprotected sex? Right? So it's very important. What route of sex you prefer? It's oral, it's vaginal, or it's anal. That's very important. And also you can ask, do you use any sex toys? Right? So this is very, very important, because if they're using sex toys, these are also like the reason they might get STI, right? They might get STI, PID, HIV. That's very important to know, like, if they're using any sex toys or not, right? And you need to ask, what is your sexual preference? What's your sexual orientation? Is your sexual partner male or female? That's also very, very important, because you will see lots of questions where the patient is a gay, patient is lesbian. So you should know, like, what's their sexual preference, sexual orientation, and the partner is male or female. Because, for example, say HIV, it's more common in homosexual, it's more common in gay patients, right? So that's how we have to take sexual history. And definitely ask if they have got any previous history of STI or PID. Because if they had previously STI, so they are prone to have it again and again. Because why they got STI? The main reason for getting STI is multiple sexual partner. The main reason is unprotected sex. So that's why we need to know if they had any previous history of STI or PID. Right, so that's how you take sexual history. And don't forget to do sign posting. Really, really important. So what we have got in personal history, lifestyle, smoking. Do you smoke? Right? So yes or no. Have you ever smoked? That's also very important. And if they say yes, make sure you go in detail. And if they have quit, do not leave chance to appreciate. Right? Do you drink alcohol? Yes or no? Diet, tell me about your diet, and accordingly you can ask whether you are taking fruits and vegetables in your diet, or you can ask dairy products if it is a case of osteoporosis. Physical activity, do you exercise? Do you get time to exercise? Are you physically active or not? Stress, do you have any stress in your life? Oh doctor, everybody has got stress. Okay, but I'm just asking, like, do you have any family or work related stress nowadays? Recreational drug, are you taking any recreational drug? But make sure how they are taking, needle sharing is there or not, because we need to make sure patient is not having any needle bone infections. And sexual history, are you sexually active? So that's how you will be taking your personal history. Very, very, very important, right? Thank you.